Hello and welcome everyone to our presentation entitled Older Adults Experiencing Housing Insecurity and Environmental Assessment of Housing. This presentation highlights findings from an environmental assessment which was undertaken as part of a larger research project. I would like to begin by respectfully acknowledging that we are on the unceded Coast Salish territory, the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. The agenda for this presentation includes a brief background and objective, followed by methods, preliminary findings, and discussion. Aging in the right place highlights that any dwelling of older adults must support and balance their unique and diverse needs, lifestyles, and vulnerabilities in order for them to age optimally. However, little is known about what aging in the right place means or looks like for older adults who do not have permanent dwelling. In Canada, more and more older adults are becoming vulnerable and are expected to experience homelessness and/or housing insecurity. Older persons experiencing homelessness often have multifaceted health and social challenges, along with substantial unmet need for appropriate shelter and housing supports. Additionally, the services offered for those experiencing homelessness or housing issues, such as emergency shelters, are often not catered or designed to address the health, mobility, and overall aging needs of older adults. Only few services exist to provide senior-specific housing supports and allow aging in place for older persons experiencing homelessness. However, there is limited literature on how shelter and housing continuum impact the abilities of older person experiencing homelessness to age in the right place. This warrants the need to evaluate innovative housing solutions, also referred to as promising practices. The idea here is that promising practices can eventually be elevated to best practices to meet the needs of older persons experiencing homelessness. Environmental audits offer an effective means for assessing the characteristics of the built environment in a standardized manner, while allowing for the identification and evaluation of organizational level data such as design and accessibility. The objective of this phase of the study was to audit a promising practice site, particularly transitional housing program for older adults experiencing homelessness and/or housing insecurity in Vancouver, using the Aging in the Right Place environmental and secondary observation audit tools. Since the focus is on transitional housing, the evaluation around aging in the right place is to examine how supportive or successful this type of housing is as a stepping stone towards aging in the right place for their clients. For methods, the Physical and Architectural Features Checklist, also known as PAF, and the Multiphasic Environmental Assessment Procedure, also referred to as MEEP, were adapted to develop the Aging in the Right Place environmental tool. PAF assesses the physical resources of sheltered care settings, and MEEP evaluates the social and physical environment in residential settings for older adults. The SWAN tool, which allows the assessment of walkability and willability of neighborhoods, was adapted to develop the Aging in the Right Place environmental secondary observation tool. These adapted tools were subsequently used to assess and collect data on the transitional housing. As mentioned earlier, the promising practice audit for this phase of the project was a transitional housing program for older persons experiencing or at risk of experiencing homelessness, which included 14 units in 4 buildings located in different neighborhoods of Metro Vancouver. In particular, the exterior and interior of the building, resident units, and overall housing complex of the 4 buildings were assessed using the Aging in the Right Place environmental tool. Similarly, using the Aging in the Right Place environmental secondary observation tool, surrounding neighborhood of the transitional housing program, such as land use, characteristics of the area, quality of public space and amenities, feeling of safety and security, walkability, willability, and street connectivity, and the overall traffic volume, speed, and noise were assessed. For data analysis, all of the questions in the adapted tool were linked to one or more aging in the right place concepts, such as functionality, accessibility, safety and security, social activity, and autonomy and identity. The sum of the questions linked to each of these aging in the right place concepts were added to indicate a baseline score, as outlined on this slide here, which was then used to rate the audited data. For example, 157 questions were linked to functionality. Using the baseline score, a rating scale with low, medium, and high scores were identified for functionality. Within the audited data, each of the yes response or responses to the questions in the adapted tool were converted to 1, indicating the presence of the linked aging in the right place concepts, and each of the no responses were converted to 0, indicating the absence of the linked aging in the right place concepts. The points were then cumulated to indicate a final score for each aging in the right place concept and situated within the baseline score to rate the audited buildings as low, medium, or high. Our preliminary findings from the Aging in the Right Place environmental audit tool reveals what each of the 4 buildings of the transitional housing program scored for functionality, accessibility, safety and security, social activity, and autonomy and identity. Since the environmental audits were conducted in early 2021, the COVID-19 pandemic posed some barriers when accessing and auditing all elements listed in the environmental audit tool. As a result, several elements were excluded. This impacts the extent to which the audit could have been performed. However, it also demonstrates that transitional housing buildings were taking the correct precautions to ensure the safety of those residing in the buildings, as well as the safety of the researchers conducting the audits. The first building of the transitional housing program, also referred to as Hall Towers, scored between 41 to 73% for the linked aging in the right place concepts, which are, as listed here on the slide, functionality, accessibility, safety and security, social activity, and autonomy and identity, suggesting that overall features that contribute to aging in the right place are present and satisfactory. Based on the developed rating scale, the scores for safety and security and social activity for Hall Towers fall closer to the lower range, while accessibility of the building was rated high. The second building, Ross Towers, scored between 45 to 68% for the linked aging in the right place concepts. Similar to Hall Towers, the scores for Ross Towers mostly fall in the medium to high range, indicating that features that contribute to aging in the right place are present and/or satisfactory. Accessibility in Ross Towers was also rated high, while social activity scored closer to the lower range. For Ross Towers, resident units were not accessible to audit due to COVID-19, and as a result, the aging in the right place concept, particularly autonomy and identity, was not audited or evaluated. The third building, Doug Drummond, scored between 34 to 59% for linked aging in the right place concepts, all falling in the medium range, indicating that features that contribute to aging in the right place are present and are satisfactory. Social activity scored closer to the lower range, while accessibility was rated the highest, but still falling in the medium range. Resident units were also not accessible to audit at Doug Drummond due to COVID-19, and as a result, the aging in the right place concept, that is autonomy and identity, was not audited or evaluated. The fourth and final building, Stratford Gardens, scored between 30 to 71% on the linked aging in the right place concepts, indicating that some of the features that contribute to aging in the right place are present and/or satisfactory. Similar to Doug Drummond, social activity scored the lowest, suggesting that Stratford Gardens is performing below the identified standard, while autonomy and identity was rated high. Our preliminary findings from the Aging in the Right Place secondary observation tool suggests that overall, the 4 buildings of the transitional housing program are located in a neighborhood that has access to public transport stops nearby, access to other community resources such as grocery store and drugstore, presence of other outdoor spaces, or I should say presence of outdoor spaces such as gazebo and parks, and opportunities for social engagement. The presence of these resources is found to support older persons experiencing homelessness with aging in the right place. Our preliminary findings from the Aging in the Right Place environmental and secondary observation tool suggest that built environment features of the transitional housing program for the most part supports the Aging in the Right Place concepts such as functionality, accessibility, safety and security, social activity, and autonomy and identity. Presence of features that allow the buildings to be accessible and support the autonomy and identity of the residents are recognized as the strengths of the audited transitional housing program. On the other hand, there are areas for improvement for increasing social activity and feelings of safety and security as they were rated closer to the lower range or rated low. Having the transitional housing units closer to or all in one building rather than 4 separate buildings can potentially create opportunities for increased social interactions and activities among the transitional housing program residents, as well as between residents and transitional housing program staff. Overall, the Aging in the Right Place environmental and secondary observation tools provide insight on the built environmental features of the transitional housing and neighborhoods that contribute towards the aging in the right place for older adults experiencing or at risk of experiencing homelessness. These tools help identify and improve features and elements at the building and neighborhood level. Findings from these audit tools combined with providers and client interviews offer a comprehensive understanding of promising practices and lived experience of older person experiencing or at risk of experiencing homelessness. Thank you for listening to our presentation today. Please feel free to visit our Twitter, LinkedIn, and website pages for up-to-date status on our work.